All public agencies, health, social care, facing unprecedented challenges, particularly financial challenges, to be able to deliver services to people to whom we want to deliver those services. So that's a particular challenge to how we work more closely together so that the people who receive our services, patients, clients, carers, don't see a join between the people who go into their homes. They don't care whether the person is a health worker, a social care worker, a person from the voluntary sector. They want to be able to see that service just provided the best service possible for them at any particular moment in their life. We've got more people who are living longer, more people who've got complex health and social care needs, more older people living on their own, more people living in isolation, people may be living in poorer quality homes that need heating. So lots of different challenges, and the better we can work together. We've got more carers, formal carers, informal carers, family carers. Derbyshire is a very high area in which we've got lots of carers, so we want to work to ensure that they've got the best possible support to help them to continue their caring role. And we also want to work with our colleagues in the voluntary sector. The voluntary sector is very important to statutory organisations. Already on the ground, health, social care, voluntary sector and carers, informal and formal, work together very closely. That's not to say we've got the finished product, but we've got lots of good work already going on to support people to remain longer in their own homes. That's our ultimate aim. The council has invested in extra care facilities to help people to remain in their own homes, and we have good liaison between ourselves and health colleagues to support people in that type of extra care environment. My staff from adult care work alongside health staff in the acute reablement unit at the Royal Hospital, helping to get people home more quickly with a proper support package to enable them to stay at home once they get there. Derbyshire Community Health Service staff sit alongside my staff in the social work department at the Royal, so they can iron out any problems between themselves. And we also have social workers working very closely with clusters of other staff around GP surgeries, so that we think not only about people's healthcare needs but people's social and healthcare needs, to provide them an emotional and social care package, practical support for people at home, equipment that people might need to be able to get them home or to keep them at home so they don't have to go into hospital, to try to prevent people going in, staying in hospital a shorter period of time and getting out as quickly as is appropriate for them and their carers.
Integrated care is really important to me, because I think that when people want the health and social care system to support them, when they really need us, they want to know that it's a joined up system and they don't want to feel the differences between organisations. So I think all of the different players within the local health and social care community working together is really important for patients, and that's why it's really important for me. I work in a hospital, so for me integrated care is really about helping to support people to stay out of hospital if we can, but when they do need our care, that they stay with us only for that period of time where they really need us, so that they can move to their own home as quickly as possible. Because what people don't realise is an extended stay in hospital isn't really a good thing for patients. The longer you stay in hospital, particularly if you're frail and elderly, the less likely you are to return to your own home. So if we can get everything working together, so that when people are ready to leave hospital, that all of the right services and support are available for them, then that's good for patients. Well, I can give you an example of how integrated care is really beginning to happen within the hospital. One of the new services we've introduced over the last 12 months or so is something called an acute reablement unit. And that's quite a long title, but what it's about is, particularly for frail elderly patients, often what happens is something happens at home, there's an acute episode, brings the patient to hospital, and I think often in the past, not only would the hospital try and address that particular specific issue, but also we'd start to do tests and all sorts of things about everything else, and then the patient might stay longer with us, and then ultimately that might lead to them not feeling confident to go to their own home. But what the acute reablement unit does is it brings a lot of specialist expertise all together right at the beginning of that patient's stay. So you've got hospital doctors and nursing staff and therapy staff, but you've also got social care colleagues and advanced nurse practitioners from the Community Health Trust working alongside all in one place in order to give that patient the right support, but most importantly to support their discharge home, because at the end of the day that's where most people want to be.
I think for the clinical commissioning group, integrated care has been one of those things that we've worked on ever since we were formed. We're really clear that people suffer services that are fragmented as they move between our various services, and actually sometimes we miss things in between. So something we've worked really hard on since we became a CCG was on the relationships between all of us, between providers, local authority, voluntary sector. We kind of felt until we knew people better, we couldn't start to work through some of those issues. Well, in simple terms, the idea is that we all work together nicely and we organise all of our services seamlessly around the needs of the individual person or their family or their community. Now, that's very easy to say. Lots of people imagine that we do that already, but actually it's very hard to achieve. So organisational boundaries seem to get in the way. People are employed by different people. People have different policies and procedures. So we're trying to kind of set all of that aside and say, okay, focus on the person in front of you and let us work out all of that other stuff that we need to overcome to make sure that the person or the family get the right service. We've just done a couple of small pilots focusing on one of our practices, Clown, and one of the Hardwick practices up in Stafford. And actually they tried for a couple of months to work in that way. And it's raised lots of great things. They've really learnt a lot out of it, but also it's raised quite a lot of issues in terms of we need to be even better at a number of things. So that's given us some really practical things now to go away and fix between organisations. I guess the other one for me is something like the voluntary sector SPA. Most of our GPs are very aware that there are a plethora of really good voluntary sector services out there, but they don't know where to find them or how to get hold of them. So we funded a pilot with North Derbyshire Voluntary Action, where there's a single number now that you ring if you've got a patient or client who needs something, and they will sort it and put them in touch with the relevant organisations. And actually the scheme won an award last week, which is really great. So.
Well, integrated care is extremely important. It's very much our priority and it's the government's priority. It's evolved. I mean, all organisations are facing massive cutbacks. The county council's facing £157 million of cuts. I know the health authority, health CCGs are facing the same sort of cuts. So it's a matter of looking together to work together. We've been doing this for some time in one way or another, small projects, but now it's our policy, one of our main policies. I know we're working very closely with health, all health organisations, the voluntary sector and other organisations to come together to provide what we hope will be a better service for people. Yeah, within the council we've got the Health and Wellbeing Board, which is, we've expanded the board. I mean, currently the Secretary of State has said that he wants providers to be included in that. We did that when we first took control in May 2013. So we've got both the commissioners and all the providers in the county. Also a strong support from the voluntary sector and Health Watch. All organisations that have anything to do with health have come together through the Health and Wellbeing Board. So we work very closely with them. So I think that's provided the framework for very much for close working integration. We've also set working groups up to specifically look at how we can integrate services, and that's met towards the end of last year in anticipation of the Better Care Fund being supported by the government. We've submitted our plans. Hopefully we'll get those approved, and that will be the basis for us working with all CCGs and all of the providers to get that better service. We've worked very closely with a few surgeries in the north east of the county, whereas workers from all areas, both health and social care, have come together to work for this is for all people, but there are examples around where the top sort of most frail elderly have worked together to try to provide a seamless service for people and patients, because it's important that people don't have more than one person turn up when it's not necessary and check in details. But if you can provide that service, in the end it avoids admission to hospital, which I think is one of the main things we need to do, because hospitals aren't the best place for people. If you can care for people either in the community or at home, then that's certainly a lot better. So there are examples, and we hope there'll be a lot more when we get further organised and further into the Better Care Fund.
I'm Andy Gregory, Chief Officer, Hardwick CCG, and our mission as a CCG is to get care as close to home as possible, keeping people as independent as possible, for as long as possible. And to do that, what we need is organisations that provide certain elements of care. So for your diabetes, one organisation might provide it. For mental health, another might provide it. Is to get those organisations and those staff in those teams to work together to provide whole person care and get you involved in that care plan going forward. Now, we know that's the right thing to do. It makes sense. It will be the right thing for me, my family. We also know we've got challenges in the system. Financially, we know the North Derbyshire health economy cannot continue as it is. But because of the system is set up in the way it's set up, people often get cared for in the wrong setting or not in a joined up fashion. So there's a real opportunity here to keep people closer to home. We've got some great examples where teams are coming together across health and social care to do the right things for people, to treat them in a joined up way. What we need to do is do that at scale, but actually let's hear from some of the people who've benefited from this, the real people on the ground, the patients, the people.
Integrated care is really important to me and Derbyshire County Council because as elected representatives we hear the poor experiences that people have across Derbyshire where they get caught between health and social care. And what I'd really like to see is a system working together, preferably with one budget, so that an individual is treated as a whole person and they're not treated as somebody that's got a social care need or an NHS need. We look at them as the person. So another reason that integrating care is important to me is I'm responsible for a budget of adult care around £214 million across the whole of Derbyshire. Over the next 4 years I've got to cut £60 million from that. Now I think that by working better with health and with the voluntary sector, a sizable chunk of that could come from transforming services rather than having to cut them. So as the Cabinet Member for Adult Social Care, I speak to a lot of people in Derbyshire who receive our services. Last week I had somebody talk to me about her mum's experience. Their mum was discharged from hospital. In the morning they had a home care worker going in, paid for by Derbyshire County Council, and then in the afternoon they had someone from the NHS come and give them some care. I'd like to get to a situation where that person is only disturbed once, they're disturbed by a person that can treat all aspects of their care in one go. The other experience that I get a lot is people being assessed by the NHS, then being assessed by social care, then potentially having to be assessed again while we argue between us who's going to pay for the care for that person. So if there was one budget and one system, then that person would be treated much better. They'd have a much better experience. And I think as a consequence, it would save us money as well.